the AMA is working for its members, addressing physicians' concerns head-on in the courtroom. Here's an inside look at one case, AMA versus UnitedHealth Group, in which the litigation center of the AMA and state medical societies did groundbreaking work to address the discrepancies in usual, customary, and reasonable reimbursement rates for out-of-network services.
This settlement, while recent, is only one of many examples of where the litigation center has demonstrated to physicians and to their patients the power of courtroom advocacy on their behalf.
It became apparent to me that there had to be some degree of dishonesty in the relationship between managed care organizations and physicians and patients. The way it was set up was a complex system where people on one side of the transaction, that is the managed care people, had a financial incentive to be less than forthright, less than fully honest with the people with whom they did business, the physicians and the patients.
The insurance company never has a conflict of interest with themselves. They're making money from the patient and they're paying the physician less, so they're making money from both.
The trust between a physician and a patient is sacred. And what I do to heal them, during that time period, it's great, but when they get that bill that says, oh, suddenly you owe so much money that was not expected because the insurance company didn't uphold their part, my job is to heal them. Their job is to secure financially that everything is paid when they need their help. If we had a defined rate, which would be considered to be usual, customary, and reasonable, then everybody would know where we stand.
Did I think there was some possibility, did I think that given the nature of the situation that they were in some ways cheating patients and physicians? Of course, I did. It had to be. The attorneys who were presenting the case to me and trying to induce me to recommend that the American Medical Association participate in this lawsuit brought to my attention on a PowerPoint demonstration a written disclaimer that UnitedHealthcare used in its license agreements with other insurance companies. We disclaim the validity of the information that we're giving to you as to what is usual, customary, and reasonable. In fact, there is no such thing as usual, customary, and reasonable. I saw that information and I said, let him put that before a jury. You have an inherent conflict of interest. What you're doing is systematically wrong. At that point, it gets to be on the front pages.
We are absolutely grateful to the Attorney General and his team, who have been phenomenal throughout this last year in working with us.
After 10 years of persistence, a resolution is in sight. An agreement is reached that creates a transparent replacement for the database. Fair Health, a research network led by Syracuse University, will make usual, customary rates easily accessible.
So now, the data will be reliable. People will know what they're getting, and it will be clear and transparent, and that wedge that was driven between a patient and a doctor will go away.
The $350 million settlement with UnitedHealthcare is one of the largest, if not the largest, settlement involving a single health insurer.
At the end of the day, what this case has brought is, I think, of value not only to the immediate monetary aspects of the case, but I think the case is of value to the whole country. The country is now a little more, on the whole, a little more honest, a little more open, and just a little bit stronger than it was before the lawsuit was filed.
Every physician in the United States is going to benefit from this. This is where we have to make people understand, make our colleagues understand that yes, we're glad to work for you, but please work with us, become members, become part of the organization, become part of the people working for you and for the benefit of your profession.